Very good morning, afternoon, or evening, depending on where you are joining us from. And big welcome to this press briefing of the Africa CDC, which is an institution of the African Union. And we are coming to you live from the headquarters in Addis Ababa. Today, for our press briefing, we are joined as usual by our host, Dr. John Kengasong. And Dr. John is the director of the Africa Centers for Disease Control and Prevention. Today, he will be discussing the situation of COVID-19 in Africa. He will be talking about the Africa CDC support to member states of the African Union. And you will recall that we have 55 member states. And then he will also update us on the progress on the rollout of vaccines throughout the continent. Then also we are joined by Her Excellency Ambassador Birgit Markerson. Now, Ambassador Markerson is the head of the European delegation to the African Union, and she's here to help walk us through the kind of support that Team Africa is providing to Africa's response to the COVID-19 pandemic. She will also delve into the issues of the work that is being done by the Africa CDC with member states of the African Union and also with international partners. Our third panelist is Dr. Merawi Arago, and he is with the Africa CDC. His role is really to update us and brief us on the highlights of what is going on during the Ebola outbreaks in DRC and in Guinea. We are coming to you in French and English, so please feel free to select the language of your choice. When we come to the question and answer session, please utilize one of these three options. The first one being this WhatsApp number, plus 251 9455 I'll give you that number again, plus 251 9455 Alternatively, you can ask your questions live or utilize the question and answer session on this Zoom platform. My name is Wayne Musabahana. I am the head of communications at the African Union Commission. It is now my pleasure to invite the director of the Africa CDC, Dr. John Kengasong, for his Thursday morning briefing. Dr. John, good morning, and you have the floor.
Thank you, Wayne, and a very good morning to all of you, all our colleagues who have joined this briefing today as always. Let me, first of all, sincerely welcome Ambassador Birgit Markerson, who is the head of the European delegation to the African Union and has been really a strong partner in supporting Africa CDC's work to really support member states in the response to this unprecedented pandemic. Ambassador Markerson, thank you so much for creating the time to come join me on this platform today. As of 9 a.m. East African time today, the African Union member states have reported the following situation as concerning the COVID-19 pandemic. A total number of 3.9 million number of cases have been reported. That represents about 3.4% of the global number. The total recoveries are around 3.5 million, representing 90%. We are very, really fortunate that a lot of people that have been infected have recovered. Unfortunately, of that number, about 106,000 people have died with a case fatality ratio of 2.7%. And that number, that is the 106, represents about 4% of the overall deaths globally. The following 5 countries account for at least 66% of all cases in Africa. South Africa has reported 38% of the overall cases in Africa, or 1.5 million cases. Morocco, 12%, or 487,000 cases. Tunisia, 6%, or 239,000 cases. Egypt, 5%, or 188,000 cases, and Ethiopia, 4%, representing 169,000 cases. The case fatality ratio of the continent continues to increase, and 38% of our member states now report case fatality rates or ratios that are above the global average of 2.2. There's a long list of them, so I will not go into the details of that. Let me now turn your attention to the variants, because they have direct consequences or impact on the conversation we are having on vaccines. 15 member states have reported the presence of the 501Y-V1 variant, or otherwise known as the lineage B117. And those countries are Angola, Algeria, DRC, Gabon, Gambia, Ghana, Kenya, Libya, Mauritius, Morocco, Nigeria, Rwanda, Senegal, South Africa, and Tunisia. 14 other countries have reported the presence of the 501Y-V2 variant, otherwise called the B1351 lineage. And these countries include Angola, Cameroon, Botswana, Comoros, DRC, Gambia, Ghana, Mauritius, Mozambique, Rwanda, South Africa, Zambia, and Zimbabwe. And you see that some of them have reported both of these variants. So what are the trends we have observed since last week and this week with respect to the epidemiologic week of this week is our 9th epidemiologic week compared to the 8th epidemiologic week, which was the week of 22nd and 28th February. So in terms of new cases, we have observed a total of 68,255 new cases reported in Africa. That represents a small decrease of 0.3%. If you all look at our overall curve, last week we were really like in a brutal shoot of about 20% decrease, but this week has kind of stabilized a little bit, and that number has not really, I would say, not changed a lot, just a small change of 0.3%. And we can discuss that later, what that means. The other regions, the highest proportion of new cases is from Southern Africa, representing 28%. And the other regions include 26% proportion of new cases in Northern Africa, 20% is in East Africa, 17% in Western Africa, and 9% in Central Africa. If you look at the deaths as well, a total of 2,206 new deaths were reported across the entire continent last week. That represents a 15% decrease compared to the week number 8. So let's now look at the last 4 weeks. We always look at the 1 week and then we put that in the context of 4 weeks. The following trends have been observed in the last 4 weeks, that is between the 8th of February and 7th of March. In terms of new cases, an overall 9% decrease in new cases have been reported across the continent. And if you look at the regions, the 5 regions, the breakdown is as follows. Again, over the last 4 weeks, 17% increase in Central Africa, a 9% increase in East Africa. However, a 5% decrease in Northern Africa, 12% decrease in Western Africa, and 19% decrease in Southern Africa. If we now break down the trends in the last 4 weeks by the most populous countries on the continent, we see the following trends. Kenya has observed a 30% average increase over the last 4 weeks. Ethiopia, 11%. Egypt, 3%. South Africa, 23% decrease. Nigeria, 23% average decrease. And DRC, 4% average decrease. We now look at the deaths. Over the last 4 weeks, we have observed 16% average decrease over the last 4 weeks. And the breakdown by the most populous countries include a 13% average increase in Kenya, 11% average increase in Ethiopia, 2% average decrease in Egypt. Nigeria, 6% average decrease. DRC, 6% average decrease. And South Africa, 25% average decrease. So let's now turn our attention to the testing. As a continent, we have conducted a cumulative total of 37 million cases with an overall positivity rate of 10.7%. Just last week, 935,000 new tests were conducted across the continent. So this is really heartwarming. If you think that last May, as a continent, we had tested just about 300,000 people. And if you now think that within a week we are conducting about close to 1 million tests, that is really a remarkable job. And it speaks to the power of the partnership initiative that we launched last year. So that number that I just mentioned, the 935,000, represents a 22% increase compared to the last week. Our team continued to work in supporting countries using the PAC initiative, the Partnership to Accelerate COVID Testing, by aiming to supply about 19 million antigen tests, an increase of 1.5 million tests from the previous week, while antigen procurement and delivery have increased also by 2.8 million. So that is very, very good. So Sierra Leone and Malawi have received additional 40,000 PCR tests that were procured with support from the Korean funds, that is, which the Korean government supported us to procure those 40,000 tests and ship to those two countries. So we continue to build on the backbone of the molecular PCR testing to expand to support countries. In the last week, the Africa CDC have trained 50 clinicians and epidemiology managers in Burundi, Mauritania, Comoros, Cameroon, Ivory Coast, Togo on vaccinations, that is COVID vaccinations. Let me just conclude by giving an update on the vaccines distribution so far. As we speak, about 22 countries have now received vaccines from the COVAX facility. And on Sunday at around 6 a.m. in the morning, I was privileged and really honored to be at the airport with the Minister of Health of Ethiopia, Minister Leah, a wonderful minister, really a strong minister, and other colleagues to receive the vaccines from the COVAX facility. Ethiopia received 2.2 million vaccines from the COVAX facility, which I've always stated that it represents and symbolizes really cooperation and solidarity. And at that the airport on Sunday, you could really see that symbol of solidarity because the European Union was there, a delegation headed by the ambassador who is here with us, Markusen, and UNICEF, WHO. It was a moment to celebrate. We're seeing everybody coming together with joy, touching those vaccines, and just feeling that we might as well be seeing the light at the end of the tunnel. It was a remarkable and unique moment for all of us. And I would just say that our task now is to work with partners like the European Union Commission and others to make sure that vaccination is rolled out at scale. So thank you so much, Wayne. And I would like, at this point, before we do the Ebola update, to return the floor to you, Wayne, so that you can introduce our ambassadors to give an update on what the EU is doing to supporting us. Thank you.
Very much, Dr. John. And as I stated earlier, he is the director of the Africa CDC. It is now my great pleasure to invite Her Excellency Ambassador Brigitte Markusen, and she is the head of the European delegation to the African Union. And she's going to be touching on a number of issues, but particularly on the kind of support that the EU is giving to the Africa CDC in terms of the African response to the African Union, the work that they're doing with member states of the African Union, as well as with other partners. Ambassador Markerson, you are very welcome, and please go ahead with your brief.
Thank you very much. And thank you very much for the opportunity to join the session. I have really been looking forward, and so has the full team. In my briefing, there are two main messages that I would like to really very clear after my presentation. One is that no one will be safe until everybody will be safe. That's one of the headlines for us as the European Union, but also, of course, as a member of the international community. Second is really that this crisis needs a comprehensive response. It needs the lights at the end of the tunnel that we saw this Sunday, the vaccines themselves, but it also needs the vaccination facilities. It needs an economic, social, and broader health response to the crisis. So those are the two headlines. Allow me to start at the global level, and then I will be very specific in terms of the work that is ongoing, because I think we are all very much tuned into what needs to be done. But first of all, the global spread, I think, of the coronavirus has posed an unprecedented challenge to all of us. It has affected all aspects of our lives and the way the world has never seen before. It's a global crisis, it's an economic and social crisis, and it is a health crisis. Solutions to exit the crisis must be found in the spirit of solidarity between our respective EU and AU member states, but definitely also with the involvement of global actors like the UN. This is crucial, really, to effectively fight the COVID-19 pandemic and ensure early access to vaccines, diagnostics, and treatments everywhere. No one will be safe until everyone is safe. This is why we, the European Union, with our partners, also the Africa CDC and the African Union, has been leading the multilateral response to make sure no one is left behind. The health security and start of a sustainable global recovery depends on this multilateral approach. We have to act as one, we have to coordinate, we have to work together. This is also, I think, the signal we're sending this morning in this press briefing. We, as the European Union, we are working with the African Union, with the African Union member states in fostering this type of solidarity and cooperation to tackle the global threats that both our continents are facing. Even in the face of eroding norms of international cooperation, the African Union has demonstrated its strong commitment to the principles of global approaches and shared responsibility. I want to take this opportunity to congratulate the African Union, particularly the Africa Center for Disease Control, Dr. John, and your team for the important role you have played in providing continental steering and cooperation, expertise, and technical support to your member states in engaging also in advocacy and mobilizing resources. Let me emphasize that although we, the European Union, is one of the most affected regions in the world right now and have been over the last year, we are firmly committed to assist our partner countries in their efforts to meet urgent health and humanitarian needs caused by this COVID-19 crisis, as well as address its long-term socioeconomic consequences. In this spirit, since the onset of the pandemic, we have established what we call a Team Europe, which includes the European Union, all our 27 member states, and we have jointly mobilized more than 8 billion euro to date. The package also includes contribution, importantly, from the European Investment Bank and also from the European Bank for Reconstruction and Development. Let me now zoom in and summarize in some points what is actually going on and what has been going on the ground. And once again, the main message will also be here that we are trying to engage along several aspects of this crisis. From the provision of in-country virtual trainings and surveillance, intelligence, we supported the coordination of the Continental Task Force, and we worked also with preventive measures and surveillance capacities in IDP and refugee camps. Secondly, we have tried as European Union with our partners in Africa to create a flexibility in our general cooperation, which means that we have tried to create space, physical space, it's called in economic terms, so that every country or the countries where we partner were able to direct the needed funds to the health sector and to the economic recovery. My third point, I would like to say we've also supported research and development of medicines and have played an important role in the production chain of the COVID-19 vaccines. We've actually also activated more than 67 humanitarian air breach operations that have reached 20 countries in Africa and beyond, and have actually carried 1.1 billion ton of essential medical and humanitarian cargo. My fourth point is also very important because we've seen and we have established a very important cooperation between the Africa CDC and the European CDC. This is important. As I said, we need a global response and we need a coordinated response. My fifth point is very much related to debt relief. We played, as European Union, we tried to play a full and dedicated role to have full and transparent implementation of what we call the G20 Paris Club Debt Service Suspension Initiative. This is again to create and look at the economic recovery and creating the space in countries to invest in the health systems. The sixth point is very much related to what we saw this Sunday morning here in Ethiopia, in Addis Ababa, because the pandemic will not end until everybody and everyone is protected. So we very much welcome the arrival of the first batch of vaccines in 22 countries in Africa that has delivered more than 14 million doses of vaccine in less than a week. Our Team Europe have contributed and worked closely with COVAX, which is the facility that has enabled us to deliver all the doses. And we have actually been helpful in making available more than 2.2 billion euro to fund this mechanism. The main focus from the European Union in terms of the vaccines itself, it has been really to support the COVAX facility that will provide 600 million doses of COVID-19 vaccines to Africa, and that will enable vaccination. We're estimating 20% of the African population. My seventh point is, as more doses continue to be delivered, the crucial task will be to ensure the rapid deployment of vaccines and associated supplies, equipment in the right condition, the right quantities, and also in the right place. In this regard, we have increased our cooperation with additional support to the Africa CDC with 1 million euro to support the rollout of vaccination campaigns in Africa, spearheaded again by the Africa CDC. This will support the vaccination campaigns in African countries with critical humanitarian needs and fragile health system through provision of cold chains, rollout registration programs, and vaccine centers logistics. The ultimate goal is to contribute to the target set by the African CDC of vaccinating 60% of the population on the continent. We're discussing actually as we speak how exactly to roll out this type of support to actually make sure that the vaccination takes place with the vaccines, as I said, in the right condition, in the right quantities, and in the right place. My last point is just looking ahead. We as Team Europe, European Union, will also work with vaccine developers to ramp up their manufacturing capacities in Africa. In addition, efforts will be made to support local production under licensing arrangements as a means to boost the vaccine production. So the battle is not over yet. In the coming weeks and months, the African and European leaders will continue working to ensure global solidarity as well as a multilateral approach to vaccination and vaccine distribution in order to defeat the virus, but also to build back better together and ensure to have a recovery that is green, digital, that involves women and as well as youth. It is our great hope, really, that the vaccine will save lives, restore our livelihoods, and we cannot say we are safe until everybody is safe. Thank you very much.
Indeed, Ambassador Markerson, thank you very, very much. No one is safe until everyone is safe. That is very true. Now, that was a briefing from Ambassador Birgit Markerson, the head of the European Union delegation to the African Union. Let me now invite Dr. Merawi Arago. And Dr. Merawi, as in the past few weeks, is going to provide us with updates of the situation in DRC and in Guinea with regards to the Ebola outbreak. Dr. Merawi, good morning, and you have the floor.
Thank you, Madam Winnie. Good morning, all. So I will give you just a brief update on the current Ebola situation in two member states. As of today, 11th March 2021, a total of 29 Ebola cases have been reported in two member states, they are Congo and the Republic of Guinea. Of these, 13 are deaths with a case fatality rate of 45%. A total of 6 people have recovered so far. Since the last briefing, one new confirmed case, 1 new death with 2 new recoveries have been reported. In the DRC, since the last briefing, no new case, deaths or recovery have been reported in North Kivu. The last case was reported on the 2nd of March 2021. Cumulative 11 confirmed cases with 4 deaths have been reported in the 4 health zones in North Kivu. 2 healthcare workers are among the cases, and 2 so far have recovered. To break down by health zones, Bena reported 5 cases and 3 deaths. Butembo health zone reported 3 cases and no deaths. Katwa health zone reported 2 cases and 1 death. Musenene reported 1 case and no deaths. Last week, there is a reclassification of days. Last week, we reported 4 cases in Bena, which is now the 1 case is reclassified as days in Katwa. 21 suspected cases are admitted in several health facilities now. In the Republic of Guinea, since the last brief, 1 reported case and 1 new death and 2 new recoveries have been reported in Lerakore, and 1 suspected case is admitted in Lerakore Treatment Center. Cumulatively, 18 cases with 14 confirmed and 4 probable cases with 9 deaths with case fatality rate of 50% have been reported in the 2 regions. 5 healthcare workers are among the cases. 8 of the 14 confirmed cases were known contacts, and 5 out of 9 deaths occurred in the community. Of the 5 healthcare workers, 2 have passed away. And so far, recovery, total recovery is 4, 1 in Conakry and 1 in Zerekore. There is no any active case in Conakry. This was the first case that traveled from Zerekore to Conakry. So there is no active case in Conakry right now. To break down by health zones in Guinea, Conakry reported 1 case and no deaths so far, 1 are recovered. And Zerekore, 17 cases and 9 deaths with 3 recovered cases. 5 cases are now currently hospitalized in Zerekore and receiving treatment. No active case is currently being reported from Conakry. With regard to response, DRC and generally active surveillance, alert investigation, contact tracing, and vaccination is ongoing in the affected regions. To date, 392 contacts listed and 82% are currently being monitored. 146 alerts are reported and evaluated. Since the last briefing, 229 new eligible persons have been vaccinated, cumulatively a total of 1,161 persons have been vaccinated. Community engagement activities, including sensitization on vaccination and Ebola prevention behaviors are ongoing. In Guinea, in general, contact tracing, active surveillance, vaccination have been heightened. The government also issued a protocol for travelers entering, living, and leaving Guinea to heighten the surveillance and cross-border surveillance and to prevent spread across the borders. As of today, 302 contacts have been registered and almost 99% are currently under follow-up. 894 new eligible persons have been vaccinated since the last report. Cumulatively, 2,438 have been vaccinated. So there is ongoing practice to do safe and dignified burial, but there is still limitation on that area. With Africa CDC, the team that we deployed returned with a clear identification of gaps and challenges, including laboratory capacity, infection prevention supplies gaps, and the technical support on surveillance and contact tracing and community engagement. Here in HQ, we are working on to get all those supplies that are needed to be shipped to to Guinea and other high-risk neighboring countries. And there is, as reported last week, Africa CDC leadership is being in a visit to these 4 countries, Guinea, Sierra Leone, Liberia, and Cote d'Ivoire. They have concluded the visit to Guinea, Sierra Leone, Liberia, and they are heading to Cote d'Ivoire. And there was a fruitful discussions that we get so far, and they really high-level strategic discussions that identified the critical gaps that we, as Africa CDC, need to chip in. So we are currently working on getting technical expertise to support member states and at-risk member states. Thank you very much. Back to you, Madam. Thank you.
Thank you very much, Dr. Merawi. Well, colleagues, we've had our 3 presentations from our 3 panelists, and it's time for us to delve straight into the questions that you have sent in to us. And we start by saying good morning to Paul Adepoju, and he is with the Lancet. And Paul has a number of questions for Dr. John. He says that President Kenyatta addressed the Universal Health Coverage Conference this morning, and he said that the African Union was just weeks behind the European Union and others in terms of delivering vaccines to the continent. So what is the latest regarding vaccine doses through the African Vaccine Acquisition Task Team presently? So this is his question, and you might have already touched on it, but you might have additional comments. Then Paul goes on to say, I'd also like to have information about the names of the countries that have ordered through AVAT, and have loans been approved? Then finally, he says, are there any countries that cannot get loans to acquire these vaccines? And what is the cost per unit of the vaccines? So these are questions coming from Paul Adepoju for you, Dr. John.
Good questions, but very difficult questions. I mean, Paul, as you know, we throw out the information on this platform as we receive it. And we also want to be sure that what we are giving you is as accurate as possible. because most of the processes are negotiations and they are work in progress. And so if we do not share anything, it's just because we haven't yet verified and re-verified that it is as accurate as we would like it to be. Timely reporting is important, but accuracy is also very, very important, so that we continue to maintain trust with the audience. So with specifics, as we said last time, the doses from AVAC, the African Vaccine Acquisition Task Team, have not changed. We are still finalizing the 270 million doses. All doses have been applied for by member states. Negotiations are ongoing now with the bank, Afri-Exim Bank, and countries which they are not private discussions, but they are discussions that are beyond my area of expertise. Remember, AVAC is a collection of stakeholders, okay, from Africa, the Afri-Exim Bank, the Africa CDC, and others, the private sector, so that are all working together. So our role there is to say to the continent, this is the kind of vaccines you should get. This is exactly why you should get this vaccine, and these are the targets that we are trying to achieve. The rest of the back-end negotiations is really out of our hands. So be patient with us. We will bring the information as soon as we have it, and with clarity, so that you do not report things that are not as accurate as possible. As we speak, as I said earlier, 22 countries have received their vaccines from COVAX. I say that not to highlight only the COVAX mechanism, but also to show that all vaccines that are coming on the continent are vaccines. Okay, there is no AVAC vaccines or no COVAX vaccines. They are our vaccines. Remember, we are the African Union. We are the Africa CDC, which is a specialized technical institution of the African Union. And we set the targets based on scientific evidence. So what we are doing is to collect all those vaccines that are coming in a dashboard, project them, and show where each country is with respect to getting to 60%. Okay, that is our role. We will use that to catalyze the process, advocate for more partners like the European Union. I was very delighted to hear from the ambassador saying she is committed to, the European Union is committed to working with us to have African manufacturing. On that note, on the 12th of April, this year, we will be convening a high-level meeting that will bring all stakeholders together in one platform, and we discuss a roadmap on how to get that going. So we are very determined and very encouraged with the support that we are getting from our partners, that we can actually begin to change the paradigm on the continent and build our own capacity for vaccine security. So all your questions, Paul, will be addressed with time, but take it that we are sharing the best as we can as we receive them.
Thank you very much for that. We move on now to Kenya, and we've had a number of questions coming in from Kenya. But the question from Judith Akolo summarizes them. And Judith is with the Kenya Broadcasting Corporation. And she says, what explains the rise in COVID-19 infections in Kenya?
So Kenya is one of those countries that I would characterize as a model for fighting COVID with only public health measures. So Kenya has gone through the first wave and was one of those first countries to come down the first wave very early on last July and August. And then when they eased the lockdowns and people started moving and giving us the touristic nature of Kenya, you saw the second wave came up. And now they brought it down very, very nicely until about 4 weeks ago, and now we begin to see that it's coming. So what is explaining that is that each time you ease the movement of the restriction on movement of people, you get the rebounds in number of cases, because this virus moves with people. Okay, that is just, I mean, if we all stay in our own little corner and don't go out at all and don't talk to anybody, within 2 months or so, this virus will be gone. But it's a very, very unusual and extremely difficult and impossible for human beings to stay put in their little corner. We are social animals, so and it's also difficult to continue to maintain economies under strict lockdowns. The damage there, people have to eat, people have to look for a daily income to survive. So that is what is driving that movement in Kenya. But the reason I say is the model is that we need to keep doing that until we vaccinate. Okay, it's like putting brakes. You're going downhill, you are holding brakes so that the car doesn't crash. So until when you finally get the vaccine will be the game changer. So that is why we are very pleased that the early distribution of these vaccines coming in March. Okay, it's a very, very good thing because, I mean, and that is what President Kenyatta was referring to, that it's not like Europe has vaccinated for almost 6 months or 1 year, and then Africa is starting after 1 year. We are almost like, if you look at the rates in Europe, they are not like, with the exception of the UK, it's not like, I mean, they vaccinated about 60% of their population, and we are just starting. So the global challenge for access to vaccines is recognized, and of course the issues that have also contributed to the restrictions are also recognized, like many rich countries acquiring more vaccines. But we should also recognize and appreciate that multilateralism through COVAX and solidarity and cooperation is also prevailing. That is what we were celebrating at the airport the other day on Sunday.
Thank you very much, John. Let's go now to Rodney Muhumuza of the Associated Press. And Rodney says, what is the director's comment on the situation in Mauritius, which is returning to lockdown after the discovery of 15 new cases? What is new there in Mauritius? And secondly, is there any assessment or new comment on the situation in Tanzania in the days since the president acknowledged that there is indeed COVID-19 in the country?
So let me start with Mauritius. Mauritius has done very well in, as we all know, in their campaign against COVID-19. But as I've always maintained on this platform, and as a virologist for about 30 years, you do not win these battles against a fast-evolving infectious disease like COVID-19 without vaccines. I mean, absolutely not. Public health measures alone will not enable us to win the battle, the war. Let me use the word war against COVID-19. You win battles here and there, but the overall war will be very difficult to be won. That is what you are seeing in Mauritius. I mean, they have won multiple battles like Kenya, but winning the overall war is very challenging without a vaccine. So that's why the vaccines that we, again, were at the airport to receive and that the continent is beginning to receive offers the long-lasting hope and solution for the COVID-19 pandemic. So that is the situation in Mauritius. So again, it's not because the people in Mauritius are doing something wrong. It's just because we are dealing with a very difficult virus. With respect to Tanzania, I've said earlier that we welcome the signs and acknowledgement in Tanzania. Different channels are being used to engage, including those from Africa CDC, to engage the government of Tanzania to take it further, to take multiple steps further to ensure that we re-engage with them to provide support. We are a technical agency of the African Union, and Tanzania is a strong and respected member state of the African Union. And the number one guiding principle is unity. So we are here to support Tanzania. We are using all kinds of channels to engage so that we can take it further from the acknowledgement phase to an assessment and intervention phase. So one step at a time, I'm sure we're going to get there.
Thank you, John. Katarina with Bloomberg in Abidjan. She says, as the vaccines start here in Ivory Coast, we see that many people, including health workers, are reluctant to take the vaccine. Are other countries experiencing the same hesitancy about the vaccine, or what could be the situation across the continent? And then secondly, she says, should Africa build its own vaccine plants?
Maybe I should start with the easier question. Should Africa build its own vaccine plan? Yes, but not every African country. That is why we need to sit down as a continent and have a comprehensive dialogue with our partners, because nothing of good will be achieved only by us talking amongst ourselves. And I said earlier, I know I'm repeating myself, on the 12th of April, we will be convening a high-level meeting, including that will be chaired by Chairperson Moussa Faki, the chair of the African Union, together with other leadership of the continent, to really address this issue in a decisive manner. So again, I'm already giving you an invitation 1 month from the date of the event. So yes, I mean, we will be working with you all to arrive at that point, which is indispensable for our health security. The health security of a people is determined by the ability to secure 3 things in a timely fashion: diagnostics, vaccines, and therapy. And one step at a time, we'll continue to build this capacity and capabilities on the continent. With respect to the hesitancy, there's a spectrum of acceptance that we see across the continent, and this is based on the science that we have conducted across the continent amongst about 15 member states, large sample size of about 15,000 people, and the rate of acceptance of vaccines as determined in that study range from about 60% to 95%. So that tells you whether I mean, it gives you an idea that you can either say that the glass is half empty or half full. If you take the countries that are clustering at the lower end of it, that is around the 60% end of the spectrum, you may say that many people are reluctant. But if you also look at the countries that are around the 80 and 90%, you may say that there's a lot of hope there. But the overriding message is that we have work to do. Okay, we will be working together with the communities to address those gaps and increase the ability to vaccinate. We should always remember that when you are dealing with a new disease like COVID, and we also saw this with the HIV/AIDS, there's an element of fear, okay, that we must recognize. And the element of fear leads to many hypotheses and also leads to the infodemics and misinformation, which is really making the population to be reluctant. But I can assure you that with the kind of campaigns that Africa CDC will be launching to engage the community, has already started engaging the community, you will see that, and then the vaccines, as people receive their vaccines, you see that the needle will shift from left to right. Many people will see that they know someone who has received their vaccines, they are not sick, and they will increase, that will lead to further uptake of the vaccines. I'm very optimistic that I mean, Africa is used to vaccination. This country, Ethiopia, was able to vaccinate about 12 million children in the middle of 12 million children for, I think, measles vaccines in the middle of this pandemic. So it means we are very capable of scaling up vaccines on the continent.
All right, we go on to Lawrence Caramel, and Lawrence says, African countries ask for derogation to intellectual property rights in order to procure vaccines. And I think by derogation there, he means a relaxation of the rules. And then he says, but which countries have the knowledge and capacity to produce anti-COVID vaccines on the continent?
So there are several countries that have that capacity to produce and capabilities to produce vaccines as a whole, but not necessarily specific for COVID vaccines. The Institut Pasteur in Senegal is currently producing yellow fever vaccines. That suggests to me that they have the capabilities of producing vaccines, and they need now the capacity to be strengthened so that they can produce COVID vaccines. In South Africa, you have about 2 groups there, the Aspen group and I believe the Biovac are producing ordinary vaccines for routine use for other immunizations. Then you go up north in Egypt, Tunisia, Morocco, they're all producing different kinds of vaccines. I think there are also sites that are emerging in Nigeria that have that the capabilities of producing vaccines, but we now need to enable them with the capacity to produce vaccines for COVID-19. I think everything, all options are on the table. I think we are also getting some early signals that if we organize, some companies may be ready to transfer technology or support the capacity development, especially for the messenger RNA vaccine. So it's all, let's remain positive, let's remain optimistic that global solidarity and cooperation will prevail. If it doesn't prevail now, with what we are going through, the unprecedented times we are going through this, and this is perhaps the greatest challenge that we have faced as a continent after independence, then I don't know when else it will prevail. So I remain an optimist in that.
Thank you very much, John. Ambassador Bridget, I saw you nodding there as Dr. John was speaking. I wonder if you might have a comment on that, perhaps in terms of what kind of support the EU is looking to provide in this regard.
Thank you very much. Yes, I was nodding because, as I said, one of my main messages was that the response to this situation that is both, of course, a health crisis, but also social and economic crisis, there we need to prepare, let's say, for the longer term. So that is also where the whole production capacity that Dr. John was talking about is so important. This is the sustainable strategy. We have a number of larger programs, both with individual countries in Africa, and we also have a larger support with the African Union to work on this type of investment. So these are the programs that we are eager to look into in our high-level dialogue with the African Union and its member states. Thank you.
Thank you very much, Ambassador Brigitte. Now we take questions that have come in through our WhatsApp platform. And we have a question from Megan Lawrence with Network 24. And Megan says, has the Africa CDC signed an agreement with the South African government to buy their AstraZeneca vaccines? And if so, what are the details of this deal? Dr. John, that's for you.
No, thank you, Megan, for joining the platform. And my apology that we were not able to respond to all your questions that you submitted online, just because we do receive so many of these questions, and given other challenges, we are not able to respond to. I really appreciate you coming on the platform to ask this question. So we are very close to signing the deal, but not yet signed, for just one reason. There is the aspects of who owns the indemnification for the vaccines. And you remember that these vaccines came from the Serum Institute, and the Serum Institute has signed an agreement with the government of South Africa. And it was very clear with who owns that the indemnification. We call it insurance policy for that. Now that we are going to get the vaccines from South Africa, you have to have an entity that stands up and own that indemnification, and then use that to engage with more countries, about the 20 countries that are approaching the platform there. So that is the only remaining step that has really held that process back. And trust me, I've learned so much with lawyers and from the Serum Institute, from South Africa, from our own AVAC, to the extent that I don't even know what it is anymore. All I want as a public health expert is that get me the damn vaccines out and let me put it in the arms of people. That's so bad. Again, the world doesn't operate the way you think in public health. So I think that is what it is. That I mean, there's no hidden agenda that we want to get those vaccines out of South Africa. They are the same vaccines that are being distributed on the continent from the same source, from the Serum Institute. So that is what we are doing to get the vaccines out of South Africa. Just one tiny step. And as last night we were on, and a lot of my colleagues here, Mirawi, Dr. Taj, and others were on that call, Dr. Benjamin, we're on to 10 midnight, at 10 p.m. at night, from 8 p.m. to 10, discussing just those issues, trying to unlock those issues and get those vaccines out to our people.
All right. Giulia Paravicini of Reuters has one simple question. when is the most likely delivery date for the 270 million vaccines through AVAT?
So the 270 million doses will not be delivered in a particular day. They will be delivered in phases because, again, I will say this, I know you all know, Julia, that the whole world is facing a production issue. So what the discussions are going in quarters. I mean, what can we get in the first quarter? In the second, third quarter, fourth quarter, and next year. So once all of that is mapped out, we're signing the agreement with Johnson & Johnson mainly, then they will tell us exactly what we receive in the third quarter and then what we receive in the fourth quarter, and we'll make that known to you. But at this point, as I said, it is my duty, our responsibility to be sure that the information that we transmit to you is as accurate as possible so that we do not go forward and backward and say that, well, you get a vaccine in April, then suddenly shift back there. We are still projecting that by April you get the first doses and continue to distribute, and then look forward to the June, July timeframe, and then September, August timeframe as well.
All right. Thank you very much. We have a question that is also related to one that you've asked earlier, but there is an additional part of it which is new. So the question is coming from Sarah Jerving, who's with Devex, and she was asking, firstly, do you anticipate that manufacturing of COVID-19 vaccines could happen on the African continent? And you've touched on that. But then she goes on to say, if so, what is the earliest date that production could start?
That is, I'm laughing because I wish, Sarah, I wish that we had, that I have the ability to say that it will start before the end of the year. That would be my, but we are hopeful that if we support groups like the Pasteur Institute in Senegal, that by the end of the year, they can actually start producing some doses there, depending on which vaccine, because all vaccines are not the same. They are not all designed the same, so that they can start producing as soon as possible. As the ambassador said, it is so important for us as a continent to have that because we truly don't know how what these vaccines will do in terms of the longevity of immunity. So if it happens that the immunity wanes after 2 years or so, then it means we need regular additional vaccination or boosting. And that will require that we have a continental capacity. So I'm really, really hoping that will be the right partnerships to start with groups like Pasteur Institute in Senegal, or I use Senegal a lot just because it's a non-profit organization. There is a government entity that they produce yellow fever vaccines, not for profit, but for public health, and start that as an example, and then see how you can roll that across the continent.
All right, thank you. Judith Akolo has come back, and she's from the Kenya Broadcasting Corporation, and she says, considering what is happening in neighboring Tanzania, where it is reported that some of the leaders are seeking treatment in neighboring countries, what is the Africa CDC planning to do about protecting neighboring countries from the spillover from Tanzania?
So that's a very good question. And Africa CDC, as you recall, works with the RECs, the Regional Economic Blocks, and we also have regional offices. Like in Kenya, we have our Regional Collaborating Center, whose role is to ensure that we have what we call cross-border surveillance, across borders, and advise countries and also make sure that they work together collectively. The best way to prevent disease spreads in a region is to have a regional network. That's what we are encouraging through what we call the Regional Integrated Surveillance and Laboratory Network in each of the regions. Just last night, I was on a call with the Minister of Health of Angola from 7 to 8 p.m. last night, discussing just that. And in the coming days, you'll be hearing Angola make some announcement. So again, it is in that spirit that we are hoping that we will continue to engage with Tanzania and have more entries and direct engagement so that we can assist Tanzania and the region, so that we have a collective response, not just a country-by-country response.
All right, thanks, John. The next question is for Ambassador Birgit. And this is coming from Paul Adepoju. And he says, some countries in Europe, including France and Germany, recently talked about releasing some doses of their COVID-19 vaccines to Africa. What is the latest on this? And how will Brexit impact EU support for Africa, especially the Africa CDC, in the short and long term?
Thank you very much. Very pertinent questions. To start with the issue of what we have done, as Dr. John also said, at some point I think the world has been faced by limitations in terms of the production of vaccines. But what we have done for the European Union is that we have ensured with our member states the buy of vaccines, and then what we have done is, and there Germany is of course part of this, we have a mechanism whereby that our member states can actually redistribute in a way these type of vaccines, and we're looking very much. That's an additional instrument to the support that I mentioned before that we are giving to COVAX. So this coordination mechanism will be very important, and it is starting. There is not a date for when it will start, but the mechanism is there. So when our member states are ready to distribute, they can use it. The second question related to Brexit and our support to Africa. I mean, I don't see it influencing, to be very honest here, on many files and on many actions. The UK is a close partner to the European Union, and especially when we talk about the issue of solidarity and the need for a broad approach where we leave nobody behind and so on, we are on the same line. So the support from the European Union and related to Brexit and our cooperation with the UK, as I see it, will not influence the support and the cooperation we have with the Africa CDC and with the African Union. Thanks.
Thank you, Ambassador. The next one is also coming your way, and it is coming from Lawrence Caramel. It's his second question, and he's with Reuters. And he says, can you explain why the European Union is opposed to the TRIPS waiver proposal that was made by South Africa and India?
I think I think this is another of the pertinent questions. I think what is the universal and the equitable access to safe and effective diagnosis, treatments and vaccine is the crucial issue really for us, as I've said several times in the fight of the COVID-19. The whole issue of the intellectual property rights, which is also in this question, with its checks and balances, in our position does not really stand in the way for the efforts actually. So it's rather part of the solution. I know there are many issues related to the transfer of the technology and so on, and the WTO rules. But for us to see these rules are already flexible enough to address the problems. So it's not that we are against it, we just think that the rules are there in the licensing of vaccine technology and know-how, including through the granting of compulsory licenses without the patient owner's consent, which can be fast-tracked actually in emergencies such as this pandemic. So it's because we think that the solution is already there. Thank you.
Thank you very much, Ambassador. And Lawrence is actually from Le Monde and not from Reuters, as I had stated earlier. Now, we have colleagues who have indicated their intention to ask questions online. So let's say good morning to Louis Katamba. Louis, how are you? Please introduce yourself, the agency that you're representing, and then ask your question. Louis, your microphone is muted. Can you unmute and then proceed? Hello, Louis Katamba. All right, Louis seems to be having problems coming through to us. Let's say good morning to Girum Chala.
Good morning, Madam Wei.
Morning, Girum. Please go ahead with your question.
Thank you so much. My question is directed to the director. Dr. Nkengasong, good morning to you as well. My question is with regards to the 60% herd immunity that you have been planning to achieve sooner than later. The problem we see now is the disparity between African states. Some states are now way forward when it comes to starting vaccination processes, and some are way, way behind as well. So how are you really planning to bring some kind of equilibrium in the vaccination processes and administration at the same time? Second question I have is, are you happy with the way Africa is handling vaccinations across the continent, those countries which have already started, including Ethiopia recently?
So I think the two questions, Hiram, are very related, and good morning to you as well. Look, as a continent, we have set ourselves a target of at least 60%. I want to underline at least, because we may be going above that to achieve our target, but that is a minimum. In the coming days, we'll be developing a scorecard that will show where the 60% is, and then show all 55 member states how they are lined up and moving towards that. That scorecard will be aimed to not shame countries, but rather to encourage countries, mobilize partnerships, develop advocacies that would make us get there. Remember, the cornerstone of our strategic plan for vaccination, which was endorsed by the Bureau of the Head of States on August 20th, is the whole of Africa approach, leave no country behind. And I think that is what we are going to do. So with respect to where we are in very early days of vaccination. So that is, when you are in a war, you celebrate every battle that you win. And the arrival of these vaccines already in 22 countries in Africa, plus those that are taken on bilaterally to start vaccinating their people, is a small battle that we are winning. I mean, you win a war by winning several smaller battles there. So that is what we are doing. And together, slowly, I'm sure we are going to get there. In the coming days, the chairperson of the African Union Commission will be working with his office so that he can launch a campaign, what we are calling the Vaccinate Africa 2022. Vaccinate Africa 2022, which is really saying that let's mobilize everything that we need across the continent, use all the assets, and think outside of the box. We are not going to get to at least 60% by 2022 if we just use primary healthcare centers and whatever. We need to think outside of the box, and that is where our partnership with the European Union is very important, partnership with others to create vaccination centers. These vaccination centers are not like bricks and mortar where you build new buildings, but how do we renovate? We could be using a stadium and other open spaces to develop and set out temporary makeshift vaccination centers and move the population. They create a demand creation so that they can go in and get vaccinated. That is the whole purpose of our Vaccinate Africa 2022, okay, to get to at least 60% immunity. This is not, we have to get there, Giram, to protect our continent, both in terms of the number, the mortality, morbidity, but also the economic loss. We are very concerned that if we do not do that, the world will get vaccinated and they will begin to impose restrictions on travel with those who have vaccination certificates to travel. For now, we are saying no. Let's get the playing field level before we can impose that, which means the vaccine be all available. Let's be rolling out vaccines. Then you can say, okay, if you don't get your vaccines, you can't travel. But then you know where to go get the vaccine. But for now, we don't yet know where to go get the vaccine. So we are still saying to our friends, partners across the world, please, let's not get down that route. It is not going to be helpful. It will only help to create inequities further and to widen that gap. So I think that your two questions, very specific, is that our campaign, Vaccinate Africa 2022, to get to 60% is a campaign that will bring the whole of Africa's spirit forward and enable us to get to our target.
Thank you very much for that. And this brings us to the end of the question and answer session. Unfortunately, we were not able to connect with our colleague Louis, but we hope that you can still continue to reach out to us on that WhatsApp number +251 9455 02310. It's now time for our panelists to give their summary of the main headline points that they want people to take away. So I'll start with you, Ambassador Bridget. In a minute or two, please just summarize your key points.
Thank you very much, and thank you once again for also giving us this opportunity, as this is a key priority for the European Union to show our partnership and make things really happen on the ground with our African partners. To sum up, 3 points. I started saying I had two main messages, and one is the importance of the solidarity and the broad multilateral approach, where we leave no one behind. Nobody is safe until everybody is safe. And this is a message that has to cut across all our activities, because that solidarity is what will bring the answer and mobilizing all levels. To sum up, my main message was really to say, we're discussing vaccines now, we're discussing vaccinations. But what we can see is, as I said, this is a health crisis, but it's also socioeconomic and it's an economic crisis. So we have to work together again in a multilateral approach to try to tackle this situation so that we can get the economies going, so that we can all get our lives back, or at least, well, I don't think we'll get it back as it was before, but we will definitely get back to a more productive and more open and being able to travel. My last point that I would like to, because we have going back to the vaccines, that I would like to summarize is, I think right now the primary goal is really to stop this global pandemic. It's the war, it's the battle that Dr. John is talking about, and I think we should definitely celebrate all these. But I want to underline that all vaccines for us are welcome, as long as they're safe and reliable. I think this summarizes those 3 points. So thank you again. Thanks.
Thank you, Ambassador, for coming to join us and for providing that really critical information, summarizing the kind of cooperation that is going on between the European Union and the African Union through the Africa CDC in this particular instance. Let's move now to Dr. John, the Director of the Africa CDC, for his final comments for today's briefing.
Thank you, Wayne. Let me repeat what I said last week. I think it's very clear, as the Ambassador very nicely articulated, that we need safe and efficacious vaccines. And once that is done, then a simple formula should always be maintained. That is, vaccines plus vaccinations equals life saved. That is going to be central to our campaign. And that will be launched in the coming weeks. And as I said, we are working very closely. We'll be working very closely with the Office of the Chairperson, His Excellency Musa Faki Mohammed, to launch our Operation Vaccinate Africa 2022, which is going to really be underpinned by Leave No Country Behind in the spirit of the whole of Africa approach. We recognize, as we have all described here, that if there's a threat in one country, it is a threat in all countries in Africa. So there's no point for one country to say, well, look, we reach a threshold of at least 60% or 100%. Remember, the president of Ghana has said he wants to vaccinate every Ghanaian. That is wonderful, and if they can do that. But if the neighboring country is not vaccinating, then, of course, the population of Ghana will still be at risk. So our Operation Vaccinate Africa 2022 is going to be a cornerstone in making sure that there is no country left behind. And that will not be achieved without, or that will only be achieved through strong partnerships. And I would like us to today also welcome the presence of the Ambassador Makusin, who symbolizes that kind of partnership. Partnership with our traditional friends and donors and really neighbors like Europe, but partnership with the media, with what you all are doing, and partnership with the private sector. One of the greatest innovations that we have experienced during this pandemic is the partnership with the private sector in developing the AMSP platform, in engaging with different vaccine groups, which are using skill sets that are not traditional in the public health domain, in negotiation, raising resources, and others. So, and lastly, innovation. We have to be very innovative, okay, develop partnerships that will bring in innovation to achieve our campaign, our Vaccinate Africa 2022 campaign. So I think that is what is going to make us win this war. I mean, but we need to celebrate smaller battles along the way, like beginning to vaccinate is key. We'll learn from it, we expand, and building the right partnerships that will get us to where it is there. I think if we do that, I have faith in the fact that we can reach that milestone by the end of 2022. Thank you, Win.
Thank you very much, John. Well, that brings us to the end of our press briefing. So let me thank you, Dr. John Nkengasong, Ambassador Bridget Markerson, Dr. Merawi, and all colleagues who were behind the scenes, but mostly to you, our colleague journalists and media professionals, for having joined us again for this session. But before we go, let me just send out a reminder that this is a press briefing. We have been receiving many questions from colleagues who do not state their media agency. So please, going forward, make sure that as you pose your question on our Q&A section, that you actually include both your name and the media organization that you work for. We will then be able to put it forward to our panelists. But thank you again for having joined us. Let's make a date for next week, Thursday at 11 a.m. East African time. Bye-bye for now.